This story that I want to tell you about is possibly really familiar to you. She's 47 years old. She's got 2 kids. She loves to travel. She's traveled all over the world in her life, and that's something she wants to pass along to her kids. The only problem is she's got this immobilizing pain that hits her a bit unpredictably. It's always there, but sometimes it gets really bad. It starts in her low back and then starts to travel down her right leg. She's quite confident that she can go on trips and deal with it, but she's a little anxious about being away from her healthcare provider. So she goes on a trip to Europe with her kids. She's got a lot of things she wants to show her kids, and with her husband, enjoy this time. But when she gets there, it flares up and she's got really bad sciatic pain down her right leg. She spends most of the trip in a hotel room, missing out. This is not a really uncommon story, and what's paralyzing about it is the unpredictability. That's why she came to me and asked me for help to try to address this problem. She just wants to stay active and live her life. Fast forward 3 months and 1 spine surgery later, this patient is feeling totally different. More importantly, pain is gone, the fear of her pain is gone, and she's a totally new person. She's now replanning the European vacation, ready to reclaim those memories that she's lost. I want to share her journey with you. So the spine is made up of 7 neck bones or cervical bones, 12 thoracic, and then 5 lumbar, and then those sit on top of your sacrum. Between each one of these segments of bone is a rubbery disc. This part of our anatomy works really well, but sometimes with either trauma or repetitive motion or whatever it is, sometimes they break down and they fail. And when that happens, the disc can herniate out, it can push out and push onto a nerve. That causes sciatic leg pain. Another thing that can happen is the disc collapses and degenerates as you end up with one vertebrae bone pushing on or rubbing on the other vertebrae bone. And that can cause back pain. It can also cause leg pain. In this scenario with this patient, not only was there a failed disc and a collapsed disc, but the disc had also become unstable. For this patient, I elected to use a new groundbreaking technology called Xvision by an Israel-based company, Augmetics. Augmetics dared to ask a simple question: what if a surgeon had X-ray vision? Then they spent years developing that. This innovative technology that they've put together allows me, as a spine surgeon, to place a headset on with glasses that allows me to look through a patient's skin and muscle and soft tissue and see the spine anatomy before I ever have to make a cut. This is a total game changer for me as a spine surgeon because I never have to take my eyes off the patient during the surgery. I don't have to look away at some X-ray monitor or somewhere else in the room to get confirmation that I'm putting the instrumentation in right. I only have to orient my eyes, my focus, my instruments directly into the operative field on the spine, exactly where I need to be and focused exactly where all the action is happening. I paired Xvision with another amazing technology called Single Step, developed by ATEC out of Carlsbad, California. The Single Step system elegantly simplifies the multi-step process of pedicle screw spine fixation, taking it from 8 steps and 6 instruments down to a single step with 1 instrument. This not only decreases the chance of spine injury during surgery, as we reduce the number of passing sharp instruments by the spine, but it also makes surgery much more efficient, cutting down the time of surgery and making it safer at the same time. We elected to use a minimally invasive TLIF approach. Minimally invasive means that we're disrupting the least amount of tissue, allowing the patient to have a faster recovery and get back to activity sooner. For this case, we removed the compression from the nerves and then removed the damaged disc. After I decompressed the nerves, causing the pain and removed the damaged disc, I used a spacer made by ATEC that I felt was perfect for this patient. Their Identity spacer is a porous titanium and it allows for faster bone-on growth, faster healing. It was perfect for this minimally invasive approach. Now that the nerves are decompressed, the bones are brought back into alignment and restored to their normal position, I use the single-step ATEC system to fixate the bones into position so that everything could heal properly. I'm Brent Kimball, and this is my dark water story.